So my name's Dr. Tom Lacroix. I'm a pediatrician here in Sarnia. What I remember about whooping cough when I started my career in medicine went back to the 1990s. And during the 1990s, we were in a phase where we were seeing a lot of cases of whooping cough. We had a large number of cases because part of the problem with the vaccine that we had at the time was that the vaccine would cause some side effects. So a lot of people started not to vaccinate their kids. During that time, we saw an increased number of cases, and what I remember really vividly was seeing a large number of kids who ended up in the intensive care unit. These kids would have whooping cough, which another term for it is the 100-day cough. It is a cough that lasts almost 3 months. Kids would cough so severely that they could break ribs, they would burst blood vessels in their eyes, they would cough to the point of vomiting, and in the little kids, those who are under a year of age, it could give them seizures, make them stop breathing, and have something that we call apnea. So apnea is when you pause in your breathing. I've actually seen kids die from this disease. What was really interesting to me is as my career started and we switched over from the old type cellular pertussis vaccine, which had more side effects and created a lot of redness and inflammation and sometimes seizures in kids who got the vaccine, we switched over to the acellular pertussis vaccine. With the more purified form of the vaccine, we were able to cut down a lot of the side effects. And what we saw was as people started to vaccinate more often, the number of cases started to drop. Within the last few years, because we have this new, more purified vaccine, we're able to give it to older people. So we started to give it to teenagers as an example so that we can protect them more and reduce the number of cases within the community. The other big group that we've been targeting in the last few years is pregnant moms and young parents, so moms and dads who have little ones. Because if we boost their immunity, again, they're much less likely to give it to their young child. So by doing these various strategies, we now see, we still see a lot of kids die across the planet, but in a place like Canada where we actually have vaccines that are good and effective, the risk of catching whooping cough has fallen dramatically, and the risk of death is lower than 1%. In Africa, where people don't have access to vaccines, this is a condition that still kills about 400,000 people a year. Most of those people have not received vaccines, and this is still considered one of the most important preventable diseases on the planet.